Inside a nondescript storefront in downtown Brooklyn, people sign up to use the bathroom. But this isn't an ordinary bathroom. It has rules. 10 minutes allowed per person, and every 3 minutes a staffer from the community organization Vocal NY checks in by intercom.
How you doing in there? Okay, you still got 7 minutes.
If no response, they unlock the door and see if anti-overdose medication is needed.
It's a safe place. I know somebody got my back outside, you know. If things get, all I gotta do is yell or hit a button. Yeah. You know? I feel everybody should have a chance because they use drugs don't mean they're bad persons.
Jeffrey Foster has battled addiction since he was 16. He says he used to use Vocal's bathroom regularly before staff helped him on the path to getting clean.
Our job is not only to keep people alive, we want to keep them healthy. We want to get them connected to services that they're able to recover not only physically but mentally and spiritually, so when they do decide to move forward, that they'll be healthy enough to do so.
If somebody is experiencing an overdose,
if Vocal has its way, their bathroom will soon be expanded into one of the first official safe injection facilities in the United States. Similar sites already exist in Canada, Australia, and some European countries. The idea is simple. If you're dead, you can't get well.
The reason people say that stigma kills is because the majority of people who die of an overdose, they die because they were alone. The number one reason, naloxone, the overdose reversal medication, it only works if you're with someone. So the majority of people who die, they're using alone, and the reason they're using alone is because they are not comfortable or able to tell someone what they're doing.
New York Mayor Bill de Blasio has approved a proposal for 4 safe injection facilities, but the plan faces federal opposition and needs approval from the state health department. Advocates see the delays as deadly. In the first half of 2017, more New Yorkers died of drug overdoses than homicides, suicides, and car crashes combined.
7 years of growing overdose deaths in this city. 7 years. At what point do we accept it's not working? We need to drop a lot more money to inside the Department of Health and Mental Hygiene, public health approaches, and create these safe consumption spaces.
Despite near universal agreement that more needs to be done, many government officials contend safe injection sites are illegal, and multiple jurisdictions around the country have moved to preemptively outlaw them. BRIDGET, New York Special Narcotics Prosecutor, has broken ranks with the city's mayor and police commissioner in her opposition to the facilities. BRENNAN fears the sites will cause neighborhood resentment and send misleading signals that drug use can be safe.
You certainly have to look at those who are suffering from chronic addiction and how are we going to help those people. You have to look at preventing people from falling into that black hole too. And I think that SIFs undermine that effort.
As the opioid crisis continues unabated across the country, New York isn't alone in its quest to find some way to reduce overdose deaths. San Francisco, Philadelphia, and Seattle are all currently looking at proposals to open safe injection facilities of their own. David Martin, The Associated Press, New York.